Hello and welcome to this week's show. I am Janet Lewis.
And I'm Dr. Lewis.
And we are Green Wisdom Health, home of your low-cost lab work and pharmaceutical-grade supplements, vitamins, and herbs to help you have a life worth living. And speaking of a life worth living, many of you out there suffer from depression, anxiety, a feeling of gloom, despair. So today's show is all about doom, gloom, and despair and where it comes from. If there's help, is it out of your head? What do you do? And we're here to open the door of hope for you. So today, Dr. Lewis is going to educate us a little bit about what can be done to make you feel good again.
Janet says it comes from here or there. I thought that came from hee-haw, doom, gloom, and misery on me, something like that.
You're dating yourself.
I'm not that bad a date, I'll tell you that. The thing about it is, if you have this doom, gloom, and depression, sometimes you need the psychotropic drugs, but they have a lot of side effects. I mentioned the other day that there was this lady whose doctor says, well, you can do the natural stuff or you can do my stuff. But he says, if you do the natural stuff, I'm not going to get involved. Well, the lady, believe it or not, I'm dealing with her now, and she decided to follow some of my instructions. There's the key. You can't do anything halfway. And I'm trying to be polite here, but I told her to get off wheat, which she did, and there's plenty of research that says, many people have wheat sensitivity or allergy. I've talked about how wheat can actually cause schizophrenia just because it irritates the GI tract, which lets you know that all this misery, brain fog, anxiety, depression can come out of your GI tract, and it's almost always part of the equation, if not always. And that research on the schizophrenia came from Journal of Biological Psychiatry. So, we're talking about well-researched, well-respected entities. And I'm glad to have that lady back and, trying to whip her depression. You hear me talk about the toxic world, and it's real, and a lot of people don't really believe it because they don't necessarily see it. And that's why I'm real bad or real good about quoting research. Mercury lowers glutathione, and there's some companies out there pushing, saying, oh, this creates glutathione, it'll make you young, rich, and good looking. Well, there's a lot of supplements that do that, but you have to have the glutathione that mercury kind of sideswipes, and it helps you make neurotransmitters in your brain and in your GI tract. And that's very important to know. MSG, people that love MSG because it's a neuroexcitatory. The book I think people should read about the MSG is called The Dorito Effect. The lady that cuts my hair said she didn't want to read it. She wanted me to read it and give her the clip notes, so I did. MSG, we've known since the 1970s, is absolutely horrible for your brain, and that alone can be the major contributing factor to stress, anxiety, and depression, but there's probably many other factors, and that's why you need help. And if you're depressed, you need to get the help of your spouse, your best friend, your preacher, a counselor, psychologist, psychiatrist. You need help, and that's the point, because usually when you get to that point, you need help. PCB pesticides affect the uptake of neurotransmitters, dopamine, serotonin, and glutamate and GABA, and that's from Journal of Toxicology. So, all this has been around for decades and decades and decades. We have the knowledge. So the point is, why are we not treating it? You want me to just ramble, Janet? I can sure do that.
Just ramble. Well, my question is, we always talk about doing low-cost lab work. Is that something you can see, depression, in someone's lab panel?
No. You can suspect it by what the GI tract's doing. You can suspect it because the thyroid's usually not right. You can suspect it because you have high basophils or eosinophils. You have a GI problem, and most likely a yeast overgrowth. You can suspect a lot of things, and we don't want to be in the normal reference range, because these normal reference ranges are normal. They cover all the weird people. Anyway, Janet tells me to be more polite about that, but it covers a sick America. You want to be an optimal range, and that's usually the top of the bell curve in the middle 30 or 40%. Some things, however, need to be high or low depending on what it is, and I always explain that, and needs to be that way for optimal health. And yeah, the labs do give you, a lot of hope of me figuring it out. But again, I had a wonderful couple in here yesterday, and the husband loved his wife enough to come in with her. And people that do this together usually have a much, much better outcome, because sometimes you have to hold her hand while they're not strong enough to help themselves. And, people say, I had a patient here a while back says, do you believe in fibromyalgia? I said, well, of course. And it was just like a relief on her face. And her husband said, we've been to about 7 different doctors that said that was, not a reasonable diagnosis. I said, well, it's just kind of a general thing, fibromyalgia. It could be, lack of magnesium. Now, lack of magnesium can very well contribute to depression, anxiety, stress, etc. But it can contribute to fibromyalgia. It can be just a low-functioning thyroid, but the doctor says, well, it's in range. It's like, well, it's not an optimal range. So it's not easy to figure out, and that's why you need help, whether it's from your spouse or a best friend or a counselor or, some sort of doctor, to hold your hand and be strong while you're weak and getting well. And we've all needed that, including me. So I'm just going to ramble a while on depression. I actually asked Janet several times in the last few months, year or two, if she thought I was depressed. And she says, no, I don't think so. Why? I said, well, I've lost interest in guns, and I'm kind of a gun nut. And she says, well, the problem is you have so many, it's hard to get excited about it. And I said, yeah, maybe that's true. I quit shooting deer many, many, many years ago. I sat and watched one real pretty, and one of the signs of depression can be if you lose interest in the things you used to be interested in, but it's not necessarily true, and that's why I asked Janet, because I needed something, a more objective opinion. One of the things that can help contribute to depression is nutrient deficiencies. I think everybody's nutrient deficient because you cannot get enough out of your food, even if you eat totally organic. And I treat a lot of organic farmers, so I know this is true, and I've read the research. And primal paleo keto is the most popular diet right now, and I personally think they're correct. Limiting the carbohydrates, but I'll talk about rice for a little bit. Not that brown rice is necessarily good for you because of the excess carbohydrates, but when you form the brown rice into white rice, you grind it, you bleach it, there's all kinds of other processes. You lose about 80% of the trace minerals. That's not enough in the brown rice, but you're losing 80% of what's in there to make white rice. And these minerals are like magnesium, which I just talked about, manganese, which has a lot to do with blood sugar and other things, copper, and zinc. And zinc is one of the common things that's low in depression. And if it goes low and stays low, then your immune system begins to take a hit, and we kind of take we can kind of make a good educated guess if your alkaline phosphatase is low that you need more zinc. That happens, with white flour. We've talked about that a lot. They used to, about 100 years ago, fortify with iodine. Now they fortify with bromine, which is one of the nastiest things you can do to wreck your thyroid. But even over 100 years ago, in a book that I have, it talked about how flour is absolutely devastating to people that are diabetics. Now, the medical book said that over 100 years ago, but then we still don't practice it. So, folks, I know you enjoy what you learn here, and thank you very much for sharing, because there's a lot of sharing going on I get a lot of referrals. And Jonathan says I'm going to have to give him money for mentioning his name. But it's not what you know, it's what you do. Faith without works is dead. So faith is a wonderful thing. You have to have it, but you have to have the works or the action step. So there's a lot of vitamins and minerals that is very necessary just for your body to function correctly. And then it can generally fix, a lot of the depression, like the toxins I talk about. On our health survey, many, it's extremely common for these people to say, I have brain fog. And one of the things we're going to talk about when we get to the supplements is thiamine. Well, if you have an overgrowth of yeast, they do something to interfere with your uptake of thiamine. If you don't have enough thiamine, that's B1, it causes the gut to be more leaky. You've heard of leaky gut, but it also causes your brain to become leaky, and it allows the toxins in the environment to cross the blood-brain barrier. And so I don't normally put people on thiamine. I put them on benfotiamine, which is the best form of thiamine. And the large majority of the people that said they had brain fog says, hey, that's gone away. And that helps to get rid of some of the toxins. And where these toxins come from, your furnishings, building construction, cosmetics, traffic exhaust, pesticides, office supplies. And Janet and I just got an RV, and I know we talked about this before, but it bears repeating, and it came out of Canada. Well, guess what? They don't allow formaldehyde in it, and you don't walk in and feel bad or get toxic or your eyes burning. We went into some other RVs the other day, and holy jeez, my eyes were watering and sniffing and snorting and snotting just from walking in that RV, apparently built in America. So, folks, make a vote with your money. So we bought this one out of Canada, and it's way, way better, even though they only let 60 in America per year. Aluminum and cadmium, if you smoke, you're just getting a huge dose of cadmium, and then you're exhaling that and killing everybody in the room with you, so you probably ought to quit it. And any man that has benign prostatic hypertrophy or swollen prostate, it's usually full of yeast and or cadmium, and you have to do a lot of magnesium and zinc to help replace that. And that comes a lot of times from a poor diet, junk foods, and that helps you become even more deficient. So other things that it can be, chromium. If you have a blood sugar handling problem, which feeds yeast, which messes with your GI tract, and most of us do have a chromium deficiency, because that's usually for us people that have sugar handling problems. I'm saying us people because that would be me more so than Janet. So when you have the chromium deficiency, it doesn't just contribute to the hypoglycemia / headed toward metabolic syndrome or diabetes. It also contributes to mood swings and depression. High cholesterol can be a chromium deficiency too. And people that get it high and then they go on statin drugs, and if they stay on statin drugs, they usually get depressed because it gets so low, you don't really repair your brain because there's not enough cholesterol there to do it. I guess, Janet, we should do a show on cholesterol someday, you think?
Oh, yeah, because that leads to depression a whole lot. There are symptoms and signs, I guess, that people, they may not even realize they're depressed.
That's why I always ask for help, folks.
Yeah, and there's, some common things. Like if you feel down, empty, and numb, that's a sign that you might be depressed. If you harbor a feeling of guilt or worthlessness, you're always upset or tearful.
Yeah, the poor self-esteem people that always say, I'm sorry, I'm sorry, I'm sorry.
Right. It's really hard on the other people that always try to bring them up, too. There are some natural products that you can take that help with that. Our favorite one is probably 5-HTP because it's the peace of God in a bottle, and it's the 100 milligram 5-HTP.
But then people say, but I've tried it, it didn't work. I said,
Right.
Try mine. And they say, holy cow, this works. I said, where'd you get your other one? It's usually the big box store. Folks, supplements are different, just like your wonderful wife you have now versus your crazy ex. Supplements are all created differently, although the FDA does check those things, but they can't keep up with everything.
Yeah, and then there's other things with obviously thinking about suicide or death may mean you're a little bit depressed.
Then if you're thinking about suicide or death or harming someone, then you run to the emergency room.
Exactly.
That's when drugs are great.
Right. Unable to relate to other people.
Can I say something about that?
Sure.
What's wrong in America today? We got a whole lot of one type of person that's really angry about the other type of person. The sign of good mental health is how many different types of people that you can get along with. And I've got friends that are murderers, mountain men, millionaires, and everybody in between. We tease on Facebook, the people that have a political view directly opposed to mine, but we still like each other at the end of the day. So if you can't stand people because they're a little bit different than you, you're the one that has the mental problem. You need to love people for our sameness, not hate them for our differences. Whoops. Okay. Did I say too much?
No, that's great. A feeling of hopelessness and helplessness. Feeling a sense of unreality. You're restless, agitated, or irritable.
Whoops.
Yeah. That can be your liver, though, sometimes, too, which is something we can see on lab.
Yeah, very much so.
If you're a mean drunk, you can see that on lab because the liver enzymes will be higher.
If you're a drunk, you've got a problem.
Well, I guess that's true.
So
if you're trying to, that's numbing yourself, isn't it?
Yeah, escape reality. Reality is what you make it. It's in your mind, in your attitude, in your spirit, and you can control. Your mind's full, and you can control what goes in it.
And you may actually have some other issues that are a sign of depression. They're physical symptoms like avoiding social events or other activities that were once enjoyable.
Well, I was going to say it'd be me because I'm not a social animal, but they never were enjoyable. I'd rather go fish and sit on the bank.
Well, I don't think that's a depression thing. I think that's a personality thing. If you once were social, and then you don't want to be anymore.
Yeah.
Sleeping too much or getting no sleep at all. That's interesting. See,
well,
that's cortisol also and can be seen on lab.
Yeah, a lot of people say, well, I can't sleep, and their cortisol's a 26. I said, well, it ought to be about a 12, 15, something like that. You're running 120 miles an hour on I-20 when it's raining, and I-20's famous for having massive amount of wrecks every time it rains a little bit. Something's wrong with the road. But, cortisol's incredibly important.
And all these tests we're talking about are available on our comprehensive panel. I have it in our show notes, a link to it. And it's actually 12 different panels, and we've talked about two of them that just now for the depression.
Right.
Thyroid can actually make you depressed as well if it's not right. So there are some markers on lab that you need to make sure are optimal.
If your thyroid ain't right, it makes your spouse depressed too. Get it checked and get it fixed.
Right. If you're constipated, it can be a sign of depression.
Because you're holding in. There are some psychological and spiritual things that go with physical symptoms. People that are constantly constipated can't let go. Think about that. People that have type A behavior have more heart attacks. People that harbor anger and fear have higher incidences of cancer. And yes, that's real. There's research to back it up. Not an opinion.
Difficulty speaking or thinking clearly. I did not have trouble speaking that. I purposely did that.
Yeah, she's full of BS. Belief systems.
Changes in your menstrual cycle.
Well, Janet says I have PMS quite often, actually.
And it is depressing for a woman to go through midlife crisis and they don't have a menstrual cycle anymore. I mean, that part's happy, but
men just buy a new vehicle when we have a midlife crisis.
Yeah, so changes of that can make you depressed. I understand. Experiencing aches and pains without any physical symptoms.
Yeah, that goes back to the fibromyalgia stuff too. Yeah. Very, very much.
Losing interest in sexual intercourse. That is actually a sign of depression.
I hear that a lot too, and it's sad when somebody in their 20s, 30s, and 40s say, I really have problems and I don't really care. It's like, Okay, so belly up to the bar and go beyond the comprehensive and add your hormones. That'll help a lot.
They need lab. Turning to recreational drugs, tobacco use, or alcohol abuse.
My favorite drug is caffeine.
Yeah. Eating
it's a drug.
excessively, which leads to the weight gain, or no appetite leading to weight loss. So you just have to know that depression can come on gradually. So some people may not immediately notice that something is wrong.
And it may be something as simple as you have a 5-MTHF genetic SNP, and that's real common. Some of the so-called experts say there's 50% of us that have that, and that's why in our formulas we don't have folic acid. We have 5-MTHF quadrifolic. That's the one that can get in if you have that genetic SNP. Janet can tell when I don't take my dose of it because I have one of the 4 possible genetic SNPs there. And she can tell you the day I don't take it. So, 5-MTHF, and we got you covered when you're getting supplements from us.
Yeah, even if you just get the B12 and 5 with MTHF.
Yeah.
It actually will be a life changer too. It'll be like no B12 you've ever taken before. So if you've tried B12 in the past and it's like, yeah, sort of, kind of, this one here is like, yeah, when you've missed it because of that MTHF that's in it. So, and that goes with the zinc deficiency. That it result is impaired membrane transport and impaired transport of B12, which can go to, you have low stomach acid. That by itself can cause depression. So you see, it can be caused by so many different things. You need to find somebody with an objective opinion. And we do have a few questions here this week that I want to make sure we acknowledge. One of them, the first one, came from our employee here. And I told her that I said, I'm going to talk about this on the podcast. And I said, I won't mention your name. She goes, oh, no, it's fine. She goes, I'm going to be famous. Go ahead. I said, it's not going to be in a positive light.
Okay, Kendall, here you go.
Yeah. Kendall, who we love. She's our new little energetic employee that works down here. Young little mind, and she's just awesome. She came in and did lab here, and that's kind of how we found her to have her start working here. And I told her she had a little bit of a blood sugar problem, and she's like, well, I watch everything I eat, and for her age, for where she is, she's doing fantastic. She does better than half of the people I know. She does gluten-free, the whole bit. Natural Grocers is her favorite grocery store. That's where she shops. And she came bebopping in here yesterday with a drink she'd gotten at the health food store. And she wanted Dr. Lewis to look at it because she said, I am so proud of this. She said, it's just full of all kinds of fruit. She said, there are no added sugars in here or any kind of chemicals. And we looked at it. The grams of sugar that it had in it were off the chart.
He's 51 or something crazy.
Yeah, it was something horribly high.
You know me, I'm so polite. I told her, you'd be better off drinking a beer.
And she said, but everything in here is organic. It's all organic fruit.
So's uranium, arsenic, and cyanide. Go right ahead, honey.
So I wanted you to talk to the people out there that are trying to do the right things, and they're having these fruit-type juices, and they're eating correctly, but they're drinking this other stuff. Is that still going to spike your sugar?
Well, yeah, God put it in the fruit with fiber, and fruit's a lot more sweet than it used to be because it's been hybridized and genetically modified. You should only eat fruit if it's in season, and yeah, I don't totally follow that, but when you eat it, you need to eat it with the fiber. And if you're going to juice it, fine. Throw the fiber back in the juice and drink it.
Because the fiber has to be in it, right, to slow down the...
Yeah, it stops or slows the glucose spike. And then the fibers, they get on this one thing, and they say, prebiotic. I said, well, geez, if you just eat the fiber, that'll give your... good bacteria, something to munch on. When you're just doing the fruit juice, you're feeding your yeast. So cut it out, And people, literally, they're drinking red wine for resveratrol, which the nitrates and nitrites kill. But I say, yeah, well, I drink screwdrivers for my vitamin C, too. And they look at me funny. I said, it makes just as much sense. So I'm not a big fan of fruit juice. I guess you can tell.
But, and I think people correlate that with, I get it out of a can. If it's out of a can, it's not good. But there are people that actually believe that if they get it out of the health food store, that it's got to be good for you because it says it's organic. You can still have a blood sugar problem with just drinking your way into it. So watch your juice. And actually, I put her on reacted chromium. I said, if I can get you on chromium, it'll stop this craving that you've got for sugar, because at about 11:30 she will literally run out of here to go get something to eat because she's crashing because that sugar has gone up and then it's beginning to dip down. It's lunchtime and she's not eating and she's got to eat something fast. So if you can stabilize that sugar and stop it from spiking, it helps depression and it helps you
quit feeding the yeast, which contributes to her anxiety. Oh, I'm not talking about her.
No.
It contributes to anxiety.
And then we have Maggie that is
she's a sweetheart. Love talking to her.
She's wanting to know, because we have a product called Thyrotane that is for thyroid primarily, but it does have 100 milligrams of turmeric in it. And she's wanting to know if that's enough turmeric to take, or is it best to add in additional turmeric?
I think more is better.
Turmeric is what, a big...
super duper antioxidant.
Okay.
And then there's some controversy about, well, you should do the turmeric with black pepper because it, opens up your blood vessels and gets more turmeric in. I don't think that's true. We've seen research that says if you do the black pepper with the turmeric, it actually helps you create a allergy to both, and you end up not absorbing both. But, you can read research that says anything and everything. Personally, I prefer it without the black pepper because of the research I've read.
Okay, and then Wendy wants to know what are the normal ranges for ferritin. And ferritin is your iron, your stored iron, not your regular iron.
I think on a woman, 30 to 70, I think 50 is a little bit more ideal. I think 30 is a little bit toward the low side. On a man, you can go 50, 75, 100. Most men have a lot more because we don't have a menstrual cycle. We just have PMS, but we don't bleed to get rid of some of that blood. And you have to, some people store it too much, and those people need to drink a lot of tea and quit eating out of cast iron pan. I'm a big fan of cast iron, but you kind of have to watch it because it can get too thick also. But 30 to 70, 100, 150 on a man, it's okay.
And that's why we run ferritin, because, there's a lot of people, most, all, come in here with a CBC and it's got their hemoglobin hematocrit and they're like, oh, no, I don't have an iron problem. I feel like I had an iron problem, but the doctor told me I did not. We have seen many times that those ranges on the CBC, they'll actually look great. The person's lab looks great. Yeah. And then we run that ferritin, the stored iron, and they're actually anemic because they don't have it in the cell. They've got it out in the bloodstream, but not in the cell. And then the other part, like Dr. Lewis said, they can be high as well, and then they're rusting out like a gate hinge because they can't process all of the extra iron.
It is an oxidizer.
Yeah, so make sure that you're always having ferritin run in addition to the regular blood panel so you know exactly what your iron is doing. And then we also want to, it's not a question, but we just really loved it and thought we'd mention it. Cricket wanted to say thank you for giving...
From Illinois.
Yeah, from Illinois, for giving her the tools to live a better life. She was so sick when she heard our show on Jack Spirko's podcast 3 years ago. I can't believe we've been doing that this long. And had been sick for many years before that. And it is wonderful to feel great again. So thank you.
But you know what made Cricket well? She did it, and she did it, and she did it. And her husband's just as much fun to deal with. And I'd like to do a quick thank you because there's so many people share. I got a great referral, Miss Tricia. She was referred by Rob in Point Orion, Michigan. Now, he's been doing our stuff forever and a day. He never calls me. He should call me Rob. And he's been super consistent. Then you got Brian down in College Grove, Tennessee. Wonderful guy. Gary in Amarillo. Golly, he's incredible. And you got people like Shauna in Tucson, her husband Rolf, and then you got Imani down in Baton Rouge. Folks, we can do this in most all different places, and the people like the ones I mentioned that are just consistent, get what? Consistent results. You got to put it into your body for it to create good things. It creates dividends in your health.
So get started today. There's no reason to be depressed, gloomy. Go to our website, greenwisdomhealth.com, fill out the health survey. It will recommend the lab panel that you need, and if you don't want to do it that way, Dr. Lewis will also give you a call and talk to you personally.
Yeah.
But
that may be a blessing or a curse. You never know.
But you will go to a Quest lab location local to where you live, have it drawn. We do this across the United States, so there's no reason to not have a life worth living. We appreciate you listening to this week's show, and we'll be back here next time. You guys have a great week.